Started coming in. I'm Deb Dingus. I'm the Executive Director for United Way of Licking County, and I want to welcome you to our monthly Community Partner Council Forum. United Way is concerned about the health, financial stability, and education of every individual in every community. And we seek to improve people's lives, helping each individual achieve their fullest potential. We do that by providing opportunities to give, advocate, and to volunteer. And I'll say a little bit more about that later. Our community partners meetings are open to the public, free of charge, thanks to our sponsors, Denison University, Licking Memorial Health Systems, Nationwide, and John Hendra Honda. We want to give them a round of applause for supporting us. Our food is provided by Snapshots, and our forums are put together by a volunteer committee who is evaluating what are those topics that are really critical conversations for our community. We have already put together a whole host of exciting topics for 2024, so make sure you grab one of these sheets. We'll seek to bring together experts locally and regionally to address topics that we can all learn and come together around to improve lives for everybody here in Licking County. Educating and convening is a part of what United Way does as well, by uniting the community to improve people's lives. If you have suggestions for future topics, I want to encourage you to write those down. There's some green pieces of paper on your table. You can write down your suggestions, your comments, your contact information. We want to include you on our newsletters and invite you to future topics and opportunities that will be coming up. With that being said, we'll turn to this morning's topic. Food insecurity is basic. As human beings, we need some basics in our lives. Maslow's hierarchy says folks need food. We can't exist without food. Individuals who experience food insecurity, prolonged insecurity, as well as hunger and malnourishment are changed physiologically, mentally, emotionally, and suffer in a variety of other ways. Food insecurity is something that all of us can do something about. Each of us have the opportunity to contribute to increasing the availability of healthy, nutritious foods to our communities. Right here in Licking County, as we look at our Alice demographics, over 1/4 of the children age 18, under age 18 in our community is in that demographic of being food insecure. That is significant. We live in the wealthiest, most resourceful country in the world. And today, in our own communities, in our own neighborhoods, children are food insecure. We are so thankful for the volunteers and for the programs that we have here in Licking County that continues to address this really important topic. And so today we have a selection of panelists who focus on this area in a variety of ways to help our community with food insecurity. I will let them introduce themselves. You'll see in the brochure a picture of who they are and a little bit about them. And the way our forum will run this morning is that we have provided some pre-written questions for our panelists. We'll give them an opportunity to answer the questions. Throughout the beginning part of this forum, if you have questions for our panelists, I would encourage you to write those on a piece of paper, and then we'll be able to ask our panelists any questions. Again, in hopes that we can all learn together and be inspired to go back out into our community and participate in addressing food insecurity right here in Licking County. So With that being said, Todd, I think you're sitting closest to me. So he gets the opportunity. We'll dive right in. And if you need to get up, you use the restroom, you need to get some more coffee or food, feel free. Please do that. Make yourselves at home. Todd, if you'll take the microphone and then when you're finished, just pass that on down the road. And Tim, at the end, all the way down there, you hold on to the mic and then we'll come back this way for the second question. And that's the way we'll do this. We are also recording these sessions so that we can put these on our website. Again, we want to make these learning opportunities as a part of our advocacy for our community free to the community so that everybody can participate in learning and being a part of the solutions and helping us to address this issue. So, Todd, again, you've already received the questions in front of you, and so we'll dive right in. If you would go ahead, describe your organization and the work you're doing to address or prevent food insecurity or hunger in Licking County.
Well, good morning, everybody.
There you go.
There we go. Well, good morning, everybody. I work for the Licking County Health Department, and my role there is the Maternal and Child Health Director. So as part of my responsibilities, I work with our home-based early Head Start station program in collaboration with leads. And I also coordinate our WIC program, the Special Supplemental Nutrition Program for Women, Infants, and Children. That is my primary responsibility, and that is certainly one of the health department's primary projects that addresses food insecurity through the program. If you're not familiar with the WIC program, it is an income-based program that serves women, infants, and children, children under the age of 5. And the original reason for choosing the age of 5 is most will then go on to school and have access to additional resources when they enroll in school. But through that program, we can provide the families with nutritious foods. The WIC program was originally designed to address health concerns related to women during conception, pregnancy, delivery, and the children in their earlier years. So the foods that we provide were specifically chosen to address health concerns. And so, different from other services in the county, we do have a specific list or array of foods that families choose from, but they are healthy in the sense that we do provide fruits and vegetables, dairy foods like cheese and milk, peanut butter and beans for sources of protein and iron. We serve about, I have to look these up this morning, we serve about 2,000 individuals in the county. That comes down to about 1,400 families. So we do have families that have multiple individuals on the program at one time, like a mom and her new baby. Through that program, we provide monthly benefits. They don't roll from one month to the next, but for a child, the food package averages about $70 to $80 a month. And that includes about $26 for fruits and vegetables, and then for the other foods as well. So it's a significant help. We are a supplemental program. We're not designed to provide all of the foods that a family might need, but we're there to help. And indirectly, what we can then do is try to educate our parents and our families that with the foods they receive from us, the other dollars that they may not be spending at the store could then be used for other needs of the family. So we do hear from some families that they don't need help with food, be it as it may. That's not a good reason not to participate in WIC, because the assistance that we can provide them can help in other aspects of their lives. The other thing that the health department does very well is interact with the public in general. And so we can become a referral source, whether we're referring to our programs or any other program throughout the community, whether it's Food Pantry Network, Job and Family Services, and all the great services that they have available. We find that one of the biggest challenges is just lack of awareness. And if we can just educate and let families know what other resources are out there, whether they're coming to the health department for immunizations, seed programs, whatever the program might be, that's an opportunity to share information with our families that come to us. Maybe not initially for that purpose, but we can take that opportunity. The other big thing that the health department does is we do community health assessments. We do those every 3 years. It's a massive project that includes data collection from a lot of other sources, as well as surveys that are conducted by residents of the county. And it's usually part of a larger survey that also includes folks from across the state. And our epidemiologist works with others to pull all this together and create this community health assessment every 3 years. And that does include questions about nutrition and food access. And my disclaimer is I am not our epidemiologist. I don't manipulate and love data as much as he does. But we do put that out online. It's on our website. It's an easily accessible resource. And that community health assessment can be a guiding tool, not only for our program, but for the entire county and all of our partner agencies on how to better serve our families. So, that's all.
Thank you. Good morning. I'm Devan with Licking County Aging Partners. I grew up here in Newark and then moved to Arizona and recently moved back. So my time back in the community has been limited, and I've been with LCAP for about 2 years. We're a nonprofit organization. We partner with Meals on Wheels America, which is a national organization, and we provide a nutritious home delivered meal, typically within the lunch hours between 10:30 and 3 o'clock is our goal. On any given day, we deliver about 1,000 meals. We also have 7 social lunch sites for those people who may not be homebound to come to one of them and enjoy a meal and get some socialization as well. We always say we're not just a meal, we're also a well check. Sorry, I should have said this first off. We serve those 60 and older in our community who live within Licking County. Anyone 60 or older who resides in our huge county is eligible for our services at no cost. There is suggested donations which help us just help more people, but it's not a requirement. A lot of our people that we serve, particularly, you know, with coming out of COVID, are living at home by themselves. We found that lack of socialization is a huge impact. So our drivers don't just leave the meal, turn around and walk away. We make sure that we check on them, see if there's anything else that they might need. And, you know, sometimes if they're not there, we call them, they call in, let us know, and then we can contact family members to make sure that they're okay. So we always say we're more than just a meal, but obviously providing a nutritious meal is the biggest service that we do provide.
There you go.
Good morning. My name is Christa Schworm, and I'm the Public Assistance Administrator for Licking County Job and Family Services. And in that role, I'm tasked to oversee the administration of SNAP, Supplemental Nutrition Assistance Program, also formerly known as Food Assistance. This SNAP program allows customers who meet income eligibility access to supplement their grocery budget. So these are, again, supplements. Eligibility is based upon household size, income, and expenses. And based off that formulation, a thrifty food plan does some budgeting, and that determines the assistance group size and the monthly allotment for our customers.
Hello, good morning. My name is Alyssa Shepherd. I'm from the Food Pantry Network of Licking County. I began my work in July 2020. The Food Pantry Network is the food bank for Licking County. So we are a network of pantries. We have 19 pantries throughout Licking County that we service. We are geared to put out 4.2 million pounds of food this year. And that we also have 15 meal programs and 8 produce markets that goes into that count as well.
Hi, I'm at the Salvation Army here in Newark and Greater Licking County. The Salvation Army is a nonprofit, Christian-based organization who's committed to meet human need in Christ's name without discrimination. So many of the things that we have are programs that directly reach out into the community. our congregate feeding program, our food pantry. Again, we're partners with Food Pantry Network. Thanks, Chuck. Chuck was in my building the other day delivering a big truck of food. The congregate feeding, the food pantry, we have a large food reclamation program here in Licking County where we have volunteer drivers, wonderful guys that go out 3 days a week and pick up food at restaurants. Denison is also one of our big donors, so we want to thank Denison. We have an emergency shelter. We can talk about that later if you wish, but you know, ours is a hands-on approach to people that come into our office with needs.
Hold that mic. All right, thank you all for introducing yourselves. We have some absolutely fabulous programs in our community, touching all ages throughout Licking County. But according to the latest ALICE statistics, again, which stands for Asset Limited Income Constrained and Employed, the report, the basic monthly cost of food for a household of 2 adults and 2 children in Licking County is $1,203. This figure could contribute to a financial burden for many households, but especially the 27% of Licking County residents living below the ALICE threshold. How is your organization helping to offset high food costs? What other efforts or resources are you aware of?
So I said that our biggest programs here in Newark for us are our congregate feeding program, our food pantry, and our food reclamation program. Also, we participate as the lead in the summer food service program for Licking County. So our congregate food soup kitchen, I like congregate food program. A marvelous, amazing program where people come together. It's not just a meal. It's just not a place where they come in and get a free meal. This is also socialization. My wife and I found in our last appointment, we had a congregate feeding program there. When COVID hit, all of our congregate meal sites were closed. That didn't just mean that, you know, now we're serving meals grab and go, but it also meant that people could not come together. These are families. Our people that come to us, our guests. We call everyone who comes in our building a guest. They could not get together with their friends or their family. They consider, you know, people their family. And so during that time of COVID, yes, we were doing grab and go. Meals were still going out of our building. We were pumping lots of meals out of our program, out of our building. Our congregate program, feeding program, serves 3 meals a day, Monday through Friday, breakfast, lunch, and dinner. And then on Saturdays and Sundays, it's supper only. There are other groups and things that take on the other meals on Saturdays and Sundays. Last year, 80,000 meals were served out of our building. But that's not just a free meal. That's a chance for people to come together and to socialize. I look out over the room, I see many of our volunteers that help in our congregate meals program. Our food pantry, with the help of Chuck and the Food Pantry Network, we give enough food for 3 meals per day for, I believe it's 3 days. I think that's what the box usually consists of. This is a lot, but then there's a lot more that we put into it. You'd be surprised how many people come into the food pantry. Hey, do you have any Harry and David today? Oh my gosh, that's like gold. Last year, over 4,000 people came through our food pantry to receive food. It may not seem like a lot of people, but it really, really is. When you see the turnover rate of food that we have in our food pantry. Our food reclamation program, I said, goes around to various restaurants here in town, to Denison. It's a huge program. It's amazing. We just in the last year made a contact out in Etna at the new Meta place out there. That place is massive, and just the amount of food that we get every 2 weeks from them really is again good quality food. They send me an inventory of all the foods that they give me every 2 weeks. And this is great quality food. This is restaurant grade. Their cook is a professional chef. So through our reclamation program, 3,000 individuals came through last year. That's a lot of people. There's a lot of food going out. And then last summer was our first go around with summer food service. 11,000 lunches over the course of June, July, and August. In those 3 months to, I believe it's 10 sites, 10 schools that we serviced last year. So again, lots of food going out. That's our thing. Food is expensive. And so if we can help to offset that food cost, then those families can use those other funds, much like everyone else, to cover other expenses, other needs in their households.
So at the Food Pantry Network, we serve Licking County residents at 200% poverty level or below. To put that into perspective, that means if you are a family of 4 with $60,000 or less, you can come visit the Food Pantry Network and visit one of our pantries. We continue to assess what we do for our residents. In 2023, we are servicing 12% of our households in Licking County. And one of the things that we've done as an organization is sort of changing with the times. And so one of the newest programs that we have coming on board is adding a more grocery store style experience. As a way to, it will offset the high food costs because when you come to the pantry, you get free food. So access is a lot about affordability of food, but there's also the conversation about availability of food. And so we've pinpointed different pantry locations within Licking County, but now time has become an issue. And so we're looking at expanding more time. So having pantries open for 30 hours or more a week. And so that way, the customer is deciding what's right for them and what is right for them. And we're not telling them when they can pick up their food any longer. The other thing that we're looking at doing when we add this grocery store style experience is opening up the regions. I don't know, many of you know the Food Pantry Network and how it works, but currently the distribution is based off of where you live. And I am a great example. I live on the west end of Licking County in Pataskla, and I work in Newark. And I stop at the Newark Kroger. I stop at the Pataskla Kroger. I stop at Myers. I don't have a designated time each week that I grocery shop. And so now we're going to bring back some of the dignity and allow people to decide what's right for them, which I think is important. And so for us, we offset the cost of food because we give out free food to those who are eligible. But I think it's also important to remember the accessibility and the availability depends on location as well.
Okay, as I mentioned earlier, Job and Family Services administers the SNAP program. And it is, again, based on income and household size. To be eligible for food assistance, you have to be at 130% of the federal poverty level. So to give you an example of that, a single individual, 130% of the FPL is $1,580 gross monthly. So if you pass that initial eligibility test, a single individual would be eligible for the SNAP program. If you are age blind or disabled, that federal poverty level increases up to 200%, and that for a single individual is $2,430. After that, it goes into budgeting where we'll say, well, how much is your rent? How much are your utilities? And through the Food Nutritional Services, FNS, they set some guidelines when we're looking at expenses. And basically what they do is, for Ohio, they call all around to different counties to get expense costs. So how much is trash in Hamilton County? How much is trash in Licking County? And they do this budgeting and they come up with standard utility allowances. And for the most part, that's what customers use in their food assistance budget because it maximizes their allotment. Each year, the state looks at expenses and they do a recalculation of the food assistance benefits. It happens every October, and that runs in November. So what we look at every November is a mass change, and it's based on the calculations, and we run everybody's food assistance case, all 18,000 cases, and adjust people's food assistance. Luckily, we do have some computer automation, and luckily some of those cases are now auto ran if there's not issues with the case. Otherwise, I hand out alerts to all my staff members to manually run these cases and issue supplements based upon the change in the FPL. I did want to talk a little bit about our stats. Last I pulled August food assistance numbers, we had roughly 16,000 individuals on SNAP assistance, and that equated to about 8,500 households. That comprised of a little over 10,000 adults and 6,000 children. I did want to mention that we also partner, not only does Job and Family Services administer the food assistance, but we also partner with some community members as well. The last couple of years, we've partnered with the Canal Market District, and some things that we've done there are really awesome. We came up with these flyers, and customers could use their food card at the local canal and have matched dollars. So they would bring their food card over to the table, and if they wanted to spend $100 in food at the canal, they could be matched with another $100 token. So that was really great. We did a mass mailing to my food assistance recipients for the benefits of the canal. That's great access to local grown, healthy food. So I thought this was a really good addition to utilizing your food assistance benefits. We also started a benefit bridge program. You'll see on your table, there is a flyer for the benefit bridge. This is a fairly new program, and it bridges the gap for public assistance and becoming stable. So what this program does is, if you were on food assistance and you got a job and an increase in wage, that's great. It would either reduce your food assistance, because remember I said it's based upon your income. So you would anticipate that increase in income would reduce your food assistance, if not terminate your food assistance. So we pull monthly reports, and when we see that there's a reduction or loss of food benefits, we refer customers to this benefit bridge program. Through this program, a couple things they can do. They can, part of that is a 4-month program where they are supplementing increments of their food loss. So month 1, you would receive a 75% supplement of your food assistance. So if you were used to getting $100, we would now give you $75. Month 2, you would receive $50. Month 3 and 4, you would be supplemented $25, just to get you used to being off the food assistance. They can also enroll in some, let's see what they're calling this, financial literacy courses. And this is going to help them learn how to budget. They help them, we partnered with some banks. They're going to help them get their credit score up. And throughout the course of being on that program, they earn incentives for participating in the Benefit Bridge program.
When I started working at LCAP, people say, oh, Meals on Wheels. Like, yes, that is our main service, but it's not the only thing that we do. The people we service that talk to you about are 60 and older. So most of our clients, if not all, don't work. So we offer other services like homemakers who come into the home and they may help with cleaning, like cleaning around the house, or they can run to the store and get groceries. We have personal care aides who come into the home and can help with like showering and bathing and different activities like that. We have a chore program. Byron goes out and he can do more of the heavy lifting, like if you need a refrigerator pulled out and clean behind our stove. We have transportation to and from medical appointments, as well as our CDI program, which adds assistance or takes care of the cost for low vision aids. All of these things that otherwise would cost the members of our community, which can help free up that money to go towards food. It was a lot for me to learn when I started here, and like I said, it's something that we constantly look at. We have case managers and social workers. If there's something we can't provide, we can refer them to Linda Higgins, and she may be able to find another community asset or company that can help provide a service so that the cost or the burden doesn't fall on the people that we serve.
In regards to the WIC program, the benefits that we provide, none of them are dollar values except fruits and vegetables. So if we provide, for example, 4 gallons of milk to an individual, whether that gallon of milk is $1 or $10, we provide 4 gallons. So right now, when you have the escalating cost of food, it does, as far as the foods that we provide, it doesn't directly impact the families. They can still get their 2 dozen eggs, again, regardless of cost. There's no cap on those. So that's helped tremendously. In regards to the fruits and vegetables, pre-pandemic, we would provide a child $9 a month. If you go to the grocery store now with $9 in your pocket and you're gonna buy fruits and vegetables, you're not gonna walk out with much. So during the pandemic and right now in the continuing resolutions that are in DC, we can provide children $26 a month. That's a help. For women who are pregnant, we can provide them $52 a month. And for women who have recently had a baby, $47. That goes a lot farther than $9, $12, $15. So in regards to the benefits that we provide, they're not tied to the dollar or the food costs, except for fruits and vegetables. Now, having said that, we just had a state meeting, and food costs for statewide for Ohio through the WIC program increased 29% from 2022 to 2023. So that cost was absorbed, if you will, through the WIC program through added costs, but the families didn't feel that at all because they were still buying their milk and their eggs and their cereal, regardless of what the price tag was at the grocery store. Another thing that we do is we also provide what we call farmers market nutrition program benefits that are on top of what we provide 12 months out of the year. These are coupons that are not good at grocery stores. They're only good at local farmers markets, including Canal Market. It's $30 a family, and we issue about $6,000 of those benefits a year as well. Very, very much loved by our families. We have a lot of families that are there the day we release them, and I assure you they are spent within the next 2 weeks. But the nice thing is because we have those, we promote all of the markets out there, but because we're able to promote all of the markets for our program, we're also able to promote the double up benefits that are available for SNAP. And so when families can see the value of the time and effort it takes to get to the Canal Market District, and you have $30 from WIC, and you can spend $50 or more off of your SNAP card and bump that up to $100, again, just the awareness piece is tremendous for these families to know that that's out there available for them. I grinned up here as each of us talked about our income guidelines, and you heard 130, 200, mine's 185. So you can see how quickly it can get confusing as to, am I eligible, am I not eligible? So within our program, I've asked my staff to become WIC experts, know our program inside and out like the back of your hand. If families have questions about other programs, we are not to answer those questions. And that may initially seem like a bad decision, but the worst thing we can do is give them the wrong information. So we would prefer to refer them to Job and Family, refer them to the Food Pantry Network, allow them to assess your eligibility, because we all do it slightly different. And on top of that, we do try to get to know the programs as best as I think that we should. So we do what my staff like to call field trips. We go and we visit these agencies. So we just went and visited the Food Pantry not too long ago. We need to come visit Christa here soon. But it helps for my staff to be able to tell my families, like, hey, when you go to the Food Pantry Network, it's a little tricky when you get off of the freeway. It's that first right. Don't drive past it and then try to turn around at the BP gas station because you're not going to get there from there. Or when you go to Job and Family, it's nice to tell them, yeah, you will park behind the building typically, and then you'll go in the front. So it's easy, it helps us to be able to relate to them as to what they're gonna see and what they're gonna do when they go. So it's not a warm handoff, but at least it's a better preparing them for what they're gonna see. Yeah.
Okay. Thank you very much. Our next question, and again, we'll start with you, Todd. In your experience, how has the landscape changed in Licking County over the last few years? Are more people experiencing food insecurity now than in the past? And has it remained the same? Or has there been a decrease?
Good for you. So, sorry, we're still in a world of COVID. Things obviously changed dramatically during that. Not only, it was just the availability of food. We know that there was just sometimes when there wasn't stuff on the shelves at all. And that affects everybody. So not only if it's not there, it's obviously a huge issue, but then when it does show up, the food costs could be exorbitant, or you could run into hoarding issues, and then that just creates additional problems. And we've seen that the WIC program is very closely tied to formula, even though within our walls it's really close to a 4-letter word, because we would definitely promote and encourage breastfeeding. But a lot of our families do use formula, and I know that was a huge factor during the pandemic, part of accessibility. And right now, you even have manufacturers that are having issues. So there's some formulas that aren't available for just manufacturing issues. But then that is a kind of like a pebble in the lake, and the ripple effect is tremendous. I think in the county, when you look west, there's lots of changes happening. I know with Intel and just everything that's going to come along with that, whether it's widening of the roads, bringing water and sewer closer to 161, and what that's going to do, that definitely is impacting our program in the sense of just the number of families that we serve. We have a main clinic for our WIC clinic, but we also do immunizations throughout the county at Pataskala, Johnstown, and Buckeye Lake. And all 3 of those communities are changing, but not necessarily in the same direction. There are still families that need services in all 3 of them. Some are going up, some are going down, some are changing. But I think we're going to continue to see that. I also think we're seeing the diversity in our county is changing dramatically. And we need to be responsive to that. We try to get ahead of that. Sometimes it's difficult because you don't know which way the change is going to go. But the faster that we can respond to the changes and learn about the new cultures that are here in Licking County, the better we can serve those families and help them overcome barriers, whatever they may be. As far as are more people experiencing food security, you have to say absolutely. I think it's going to vary from where you're looking and who you're asking. It will definitely vary from, I think, different age populations. It's going to vary demographically, whether you have access. We have been very fortunate with what's coming out as far as transportation, with what LCATS is creating with the bus lines that are coming out. It'll take time for families and just people to learn where they are and how they run, but I think that has a lot of potential over the next few years as people learn about that and learn how to use the system. I think that'll help tremendously, but I do think there's certainly a food insecurity challenge. I don't know that we'll ever extinguish it, but I think the best we can do is continue to address the changes and do the best that each of our programs can do.
As I said, I moved back here kind of during the pandemic, and have been with LCAP for a short time. I do know that when the pandemic was going on here, home delivered meals was the only service that we did, to make sure that those who definitely needed the food were able to get it on a daily basis. I think another thing that has changed with COVID is during that time, we received a lot of funding, where we were able to do a lot of things, a lot more things, and now that funding has kind of gone away. Which has provided us a challenge of how do we still serve all of those that have the need without that funding. Our kitchen manager has gotten very creative, not just with the cost of food, but the cost of the containers and the wrap that goes into it seems to be skyrocketing. So those are challenges that we face. Recently, we just looked at and rerouted all 21 of our routes and added a 22nd route in anticipation that as people come out of COVID and are more comfortable with people coming back to their homes, particularly with the demographic that we serve, we are gonna see, or we're preparing for an increased need. So we did add a new route this year, and we're trying to get the routes that some had become overburdened and had 70 deliveries a day down to a 40 to 50 area range, so that as expansion out west and people move in and we see growth in areas, we can add to a route that has 40 to 50 deliveries and maybe get back up to 50, 55, as opposed to one that's 70, 90 delivering 80 meals a day. So those are just things that we're looking at, and always keeping an eye to the future on how we can adjust to what seems like the ever-changing need for our services and the growth.
When I think about food assistance over the last few years, obviously COVID was a really big deal and food insecurity for our community. When I think about prior to COVID, when I would quote my food assistance roles, I would say I had roughly 15,000 individuals on food assistance. In 2019, it was late 2019 when we learned that it was actually COVID. My roles jumped up to around 16,000, and it continued to grow. In 2020, we had a little over 17,000. And then in 2021, roughly 18,000 individuals on food assistance. We have seen that start to decrease, and I pulled my stats from last August of 2023, and it was roughly 16,000 individuals. So I'm getting back to what I had experienced prior to COVID. Also, some of that I relate to some of the growth in the community, obviously out west. The manufacturing jobs, so we have less people on food assistance just because of the employment that's out there.
Okay, so in the last few years, the food insecurity in Licking County, for us, our customer base dropped. There was more government assistance, WIC was up, food stamps were up, and so our customers didn't need us. And so when they have the resources that they have, then they don't come to us. Looking past COVID, before COVID, we had maybe what we might call self-inflicted growth. So when we added the produce market in 2013 or 2014, you saw a spike. Every time we add a pantry, we see a spike. We're putting those pantries there because the need for food is there. With this new market idea, as we open up our regions, as we open up for longer hours, chances are we're going to see a spike. That's why we're implementing these programs. This year, 22% of our households are new to us. So this is the first release. This is the first time that they've utilized the food pantry network of Licking County. And so to me, that's a big number because there's a lot of people that are facing some insecurities because of inflation. Looking historically at some of the data, Feeding America states that going back to the 2008 recession, it took us 10 years to get back to pre-recession numbers. So for 10 years, people were impacted and using the food banks more than they were. And so it was only in 2018 that number dropped back down. And so again, for me, that's concerning because it's sort of looking at, it has affected all of us, right? COVID has affected all of us. Now as we get back to normal and we're having these big events and things again, the media put such a focus on food insecurity, and it's now worse than it was in 2020, 2021, because they had the resources, which is great. If it wasn't out there, then the resource wouldn't be there. And that again, Todd, you mentioned how difficult it is for the pantries to know where to send people. Hopefully, again, our market will change that for you. The hoarding issues that Todd mentioned also, it will be a different kind of mindset for our customers to hear that hey, you can go to any food pantry that's open in Licking County anytime you need the food. And so for them, it hopefully will put a relief as in I don't have to go now because I know they'll be there for me again tomorrow too.
My wife and I were not here, 3 years ago. We were, at the beginning of COVID, my wife and I were stationed in Hartford, Connecticut. And we saw firsthand there a lot of, one of the things we kind of chuckled about, it wasn't really funny, was hoarding of necessities like toilet paper. My wife got excited one day. She went home from the office and she stopped at the grocery store and there was toilet paper on the shelf. She was excited about that. She put that out on Facebook. When we moved back to Ohio, in 2020, we moved to Worcester. And, we saw there and we heard the stories of what it was like, what COVID was like during that time. Again, grab and go, everything was, not coming together. There were shortages. Yes, there was a lot of money between 2020, 2019, 2020, 2021, 2022. The government gave out lots of money. And it made all of our budgets look great because now we could afford this. But now we're all having to face the idea, we've got to come back now and adjust our budgets back to pre-COVID times. And yet the demand is still there for those COVID services, the numbers of people coming to us. We're seeing the same thing in our office. I look at my board and I say, okay, I'm adjusting the budget down. We're going back to pre-COVID time, but they're saying, what are you doing for the numbers? And until I have to, we will, we'll adjust in other places to find the resources to get the food that we need. We rely even more on the food pantry network. We rely a lot more on our partners in the community to help us continue to meet the needs of the people that are coming into our office.
Thanks. All right, hold on to that, Tim. Coming back up this way now again, question 4. What are some of the issues that contribute to hunger or food insecurity from your perspective? And what can we do as a community to help combat these issues?
I don't think there's any one cause. Life, okay? Life. We all have utility bills. We all have housing costs. We all have transportation costs, food costs, medical costs, all these costs. What it comes down to is choice. We all have our limited personal budgets. How do we put into all of the buckets that we have to put into? And most of us in this room, I would say, are very lucky. Most of us are not 1 to 2 paychecks away from having to go and ask for assistance. We're very fortunate, I believe. Our friends, our neighbors out there are probably 1 to 2 paychecks away from having to come to any of our doors and request assistance because life happens. And we have to decide what we are going to do with the limited amount of money that we have coming into our homes. My children laugh at me because I say, your mother and I are on a fixed income. And my son looks at me and he smiles and I said, no, I said, son, our paycheck is the same amount every 2 weeks. And we have to decide what goes here, what goes here, what goes here. People that have that stress on them only grows if they're having to worry about job loss, if they're having to worry about the cost of food going up. I can't imagine $9 a month for fruit. I can't imagine that. That's hardly anything when we get that, but I'm glad to hear that there's additional help and assistance. I'm glad to hear that, I can make this decision. If I have to fix my car, I know that may take out some of my rent money, that I can go to an agency and I can get help with my rent, or I can get help with my utility bill. Again, all of those services, we coming together as a community, looking out for our neighbors, our families. And I say that in the broadest general terms, our families. So that when someone comes to us and says, hey, I need help with this, I feel good that I can help them with that, because I know that that resource is now can be put in another area in their life.
Okay, so I think, you know, we hear a lot about medical issues that contribute to, costs in the household, and so then you're deciding, do I take that monthly medicine I need? Do I pay for food that day? Do I take half the medicine and then eat half a meal? Neither of those are good options. Car maintenance, rent costs increases. So again, it's the issues that are hitting all of us. It's just how bad it's hurting some of the others. I think that it's important to remember, like, these kinds of when you talk about how do you combat these issues, these kinds of conversations are good. These organizations exist in the community because food insecurity is here in the community. And I think it's great that we have the resources to, and work well together, a new to Licking County. And so to see the partnerships, to see how many people are showing up for food insecurity, to talk about the issue in the community, I think that that's great. That's a great start. We're here because it exists. And so how do we combat it? But again, it's life costs. And so how do we help people? You know, for me, I feel like sometimes it's easy because we just need to look at how we can get people who need food. And if we can maybe take that burden off of them, then they can worry about the other burdens that they have. There's studies that people will feed their pet before they'll feed themselves because it's their own companion. Yeah, and so so many of you are shaking your heads, and I think that to me is the important piece, is that we're here, we're talking about it, so that we can stay on top of it. Again, prior to being at Food Pantry Network, they made a lot of changes, going from boxed food to choice pantry to adding the produce market. Now we're looking at the grocery store style experience to expand access. And so trying to stay on the forefront of the issue is the biggest thing we can do, because the costs continue to rise in other areas.
Yeah, I agree with that as well. When we're looking at what contributes to the food insecurity, a multitude of things, lack of jobs in the community, lack of job opportunities, lack of affordable housing. I'm seeing rent costs that are more than mortgages right now. When we're looking at customers that have health conditions and they have to choose between their medicine or buying affordable food, even mental health. Customers that are dealing with mental health, the food is not necessarily at the top of their mindset right now. Also, maybe transportation, lack of transportation to get to job and family services or the food pantries. And I did want to mention, now there's something that's fairly new with the food assistance card, is that customers can purchase food. I mean, how you do, I don't do it, but you do grocery pickups or you order online and you can have your groceries delivered. That's something that's new for the food assistance card. What can we do? Volunteer, donate, volunteer, our United Way. I know my agency passes around a sheet where we do donations. Donate directly to the food pantry where they can make their dollars stretch. And I wanted to say collaborate as well. This is, we see a lot of the same customers, and one situation that sticks out in my mind is, excuse me. I had a customer who had his food assistance card stolen, and through my policy, I was not able to make his food assistance whole again. And so I collaborated with Chuck at the food pantry, and my customer also lived in Pataskala, so he had a transportation issue. And so with Chuck and I collaborating, I got to go over, and it was really nice because I got a tour of the facility and personally picked up the items and took to this gentleman who had a teenage daughter who also just recently lost her mom. So just collaborating with the community, I thought that was a heartwarming story, and I was just glad to have my other community partners to back me up as well.
I'm kind of thinking the same thing that everyone has said, just the rising cost of everything is affecting us all in different ways. I think as a community, we can help by spreading the word about the services that we do have available. Everyone coming here today, hopefully, you learn something that you didn't know about, and then you go tell a friend, they tell a friend, and it just kind of catches like wildfire, so we can help more people who need it. I was gonna say volunteer not only, or donate not only like money if you can, but also your time. I know the Lookup Center has Thanksgiving meals that are delivered on Thanksgiving Day that we're doing again this year. We have a holiday bag, December 8th, if anyone's interested in helping volunteer, to deliver those to members of our community who need them. There are opportunities out there, but I think people may not know that they exist. So just kind of spreading the word, telling friends, telling family members, letting people know that they can get involved. And it doesn't always take money. I mean, we can all give up our time. And I think that would help us reach those who definitely need our services.
The bad part of being last. But yeah, pretty much everything everyone has said. I think Tim said it great. He said life happens. And I think that's something we have to keep in mind is food is just one piece of the puzzle. And we can try to help with that, but there's lots of other pieces that might not be easily located or put in the right place. I think the idea of coordination is great, and I think we have examples of that are in place, but I think there's more opportunity that exists, and we just need to find those opportunities and take advantage of those. For one that I will share is coordination services with leads. Head Start Center, we now go to the center. They don't provide transportation for their children, so at morning drop off, the adults are there. And so WIC sets up whatever you want to call it, mobile clinic. We set up there, and so families can kill two birds with one stone. Drop off their children for preschool and take care of the WIC benefits. And I think as more opportunities like that present themselves, I think we need to take advantage of that. And I think that's one of the good things that came out of the pandemic is I think that opened all of our eyes to things that maybe we could do. It kind of just shoved you and you did it. And it was either, swim or sink. And I think a lot of us turned out some really great, innovative things because we didn't have a choice. I think we do collaborate well, and I think there's always opportunities to do it better. And I think just, again, that whole awareness piece. Transportation, I know, has always been an issue. LCAS has stepped up with the new, I forget the name of the line that they call it, but they've got the I can never think of that word, but, and then, as the health department, we have an Uber health opportunity. So if families need help with those, we can coordinate that for them. So it's a on-demand transportation, and there's no one answer to any problem, whether it's transportation, hunger, and food insecurity. There's going to have to be lots of answers and attempts. And the other thing that I'll throw out there is the role of online. I know families are food insecure, but almost all of them have a smartphone. So what can we push out online? And I'm old. I was forced to get a smartphone. I'd rather have a flip phone. I'd rather have just a phone hanging on the wall if I could. But everybody's using smart technology. So if there's any way that we can link services or link resources so that it's one-stop shop kind of thing. If they go to look up WIC, it'd be nice if we could have some information on there about Child and Family Services, Food Pantry Network, Salvation Army, other resources that might be addressing why they came to my page or our page on our website. So.
Thanks so much. So Licking County is a huge county. We've got a variety of different communities within our county. Who do you think experiences the highest rates of food insecurity in Licking County? And do you see geographic factors playing a role in food insecurity?
So the best way for me to measure this is going to be our enrollment in our WIC program. And unfortunately, with the pandemic, that did not help. Trying to find a baseline and be able to assess growth or decline. But in Ohio, our WIC system is based off of a smart card, which means it has a microchip on it, which when we went to this system seemed like a fantastic option because of some of the perks that it offers as far as security and what have you. Well, since we adopted that, and we've gone through the pandemic, we saw what a limiting factor that was, because in order for us to make any changes to that card, the family had to come into our office. And so during the pandemic, we never shut down. Our office was open. We did phone call counseling, but the family had to ultimately physically come into our building to have benefits loaded on their card. The state of Ohio saw a decline in caseload, as did most every state that has the card system that we have because of that. Other states have an online smart system where, this is oversimplifying it, but with a matter of touches of buttons, they can push benefits out. The families don't have to come to the clinic. So you saw growth in WIC in other states during the pandemic, which is what you would kind of anticipate seeing, is that families are having, access challenges, and here's a program that you could sign up for that would help provide resources. They're going to do it. And you saw that in some parts of the country. You didn't see it in others. But here in Licking County, we have seen the decline in caseload in Buckeye Lake and Johnstown. And there's just things going on in those communities that can kind of explain what's going on. Pataskala, we've seen tremendous growth. We do what we call satellite clinics. We go to Pataskala. We used to go 2 days a month. We're now going 3 days a month because the demand is such that we need to provide more opportunity. And that third day is filling up to the point where we're going to just continue to add until we have to add a fourth day, if that's what we need to do. Because getting from Pataskala to Newark, if you ask families in Pataskala, it's driving to Kansas. It is an extremely long drive from Pataskala to Newark. And some people I don't mean to make light of this, but some may think they just drop off the edge of the world when you go so far east, because they just never go east for services. They go to Reynoldsburg and Hickoryton. So to have them come here, we need to take our services where they are. So we've seen tremendous growth in Pataskala, and we're seeing Newark is kind of rebounding. We've had, and this statistic makes no sense, but since we had the financial, whatever in 2009, our caseload steadily declined until 2022, and now we're on the rebound. You would think when there's financial issues, more families would come for support services, but that doesn't always pay out or play out that way. But we are back to 2021 number, which sounds weird, but again, keep in mind, we tanked, that's probably not the best word. We went down during the pandemic. We have hit bottom. We are on the way back up and seeing good growth, which is positive. But we definitely can see a geographic difference when you look, at least in our county, where our clinics are located.
I think those who experience the highest rate of food insecurity are those who live alone on a fixed income and may not have family members close to who can help provide to meet some of their needs. The geography, I think, also definitely plays a role. I know over on 21st Street, we have a multitude of grocery store options in Heath, Pataskala, we have that, but in the northeast portion of the county on my Licking Valley route, that's a difficult area for people to go out and get groceries. And another thing I think, particularly with our demographic, is a lot of the people we serve don't drive, whether by choice or just because they can't anymore. So being able to get to a store may be an all-day task. Another thing is if someone lives closer in town, they may be close to an option, but they may have mobility issues. I know when I get home from the grocery store, it's a personal challenge for me to take all 20 bags in on one trip. I can't imagine what that's like trying to, even with the services provided, maybe transportation to a grocery store, to then have a full week's worth of groceries or more, and then get it back to where I live and get it in and get it put away. So those are definite challenges that, the members of our community that we serve, we have to take into account when we're trying to help them as well.
Yes, I just reiterate what Devan said. Those who experience the highest rate of food insecurity would be those individuals on fixed incomes, your elderly disabled on Social Security and SSI, who only get that once a year cost of living increase. Those with transportation issues. But that did put in my mind here is the amount of dollar stores that are popping up all over the county, although that's not fresh fruits and vegetables, but it is a gallon of milk, and I am thankful for those stores. Sometimes I need that gallon of milk and loaf of bread as well. So, yeah, just lack of transportation and fixed income, employment opportunities as well.
So I think this was an interesting question to me. Do geographic factors play a role? Moving into Licking County, there's a lot that I learned about the community, and even choosing where I was going to live and some things that I had heard. And as I'm out in the community, sometimes people will say, well, we're from Granville, we don't have that issue. And I very much have had phone calls from people from Granville saying, I'm looking for a food pantry. And so I think it's important that it's everywhere. It's everywhere within our county. And so I don't think that it is, there may be a higher rate somewhere. And I think those are the locations where you see the services. And then it's growing and it's everywhere. And so that's why we're popping up in these other communities as well. So I don't think that the geographic factors play a role within the county. And then we do serve more families than we serve seniors, but yeah, those that are on a fixed income, they definitely did, they come to us. And that was one of the seniors dropped during COVID. And that was because their max allotment was such an increase for their monthly budget that, again, they didn't need us. But now that they're back down to their regular income, the cost of inflation, seniors, are one of the biggest. So I'm going to echo that too.
I think living in a rural and an urban area are much different. In an urban area, everything is right there, high concentration. Yeah, we live on the north end of Newark, so there is, 21st Street is covered with grocery stores, so we have great choices there. But again, when you get out into some of the more rural sections of the county, it just isn't there. So that transportation is the big thing. I am so thankful for the bus route that's come in, and then there's going to be another line coming off of that, and possibly a third, maybe. I'm not sure. I don't want to speak for the county. I'd like to see a third, but geographic location, geographic proximity, I think is the biggest thing. We're all in need of something. We all have needs. It's getting to that place where we can get that need met. So if it's groceries, yeah, I live on the north end. I have great grocery stores all around me. I'm good. But I may not have something else, and I may have to travel. And again, that's a choice I'm going to have to make. Do I put that choice, that use of my vehicle, which is going to take gasoline and wear and tear on my car, am I going to take money out of that bucket in order to have this? So it's all about choice. But yes, I believe geographics play a pivotal role. Is it with, am I close to getting my needs met, or do I have to travel to that location? That's a big choice. That's a big decision.
Thank you. Let's see, 11:15. We'll go to our next question. What misconceptions would you like to clear up about the causes of food insecurity and the people who experience it?
I think it's not so much the insecurity. I think it's the idea of poverty. Poverty is huge. So many misconceptions about the root causes of poverty. People will say, oh, they're just lazy. They don't want to do it. They don't want to work. They don't want to go out and help themselves. They want a free handout. That just is not true. At least in my experience, people that come to us, people that come into our office, I can talk about Christmas till it's coming out my ears. The mom and dad with a couple of kids that have no way of providing Christmas for their family, when they come to us and they get food and they get toys, we have watched people weep. We have watched people cry. The realization that this is going to be their only Christmas. These are not lazy people. These are people who are trying their hardest to provide for their families. They just need a helping hand once in a while. It's hard for them. It can be a pride thing of going and asking for help. That's hard. That's hard for me to ask for help. When I have to go to my 5-year-old grandson and say, hey, can you show me how to do this on the iPad? And he says, oh, Papa, I can do that. And and he shows me how to do it. That's hard for me, that I have to go and ask for help. But this is the reality. Sometimes we have to ask for help, and it's not because we're lazy or we don't want to do it. It's difficult. That for me is the biggest misconception. People are not lazy. You may have a small, very small population, but they're not lazy.
Yeah, well said. I'm going to echo that. There is a sense of independence that we all have. There's a dignity through finding the resources to provide for your family, and it's hard for these individuals to ask for help. One of the biggest misconceptions is that people are abusing the system or overusing the system. And, you know, I call that chronic food insecurity, and that's an issue that leads to health issues. We have, the way that our pantry operations are set up right now, a family that utilizes our emergency open pantry, our produce market, and then their regular monthly pantry can visit us 119 times a year. The average customer comes to us 8 times a year. So they don't come to us unless they really don't know where else to turn. And I think that's, again, the biggest misconception is that they're in the system, they know how to use the system, that it's not 22% of our, I'm gonna echo what I said earlier, 22% of our customers are new to us this year, and the average customer only comes 8 times a year. So they're only here when they don't know what else to do, or where else to turn. And there is this dignity and independence that we can provide for them that empowers them instead of, you know, makes them feel like they're not doing well on their family.
When I think about the misconception and as it relates to my recipients on SNAP, as Tim had mentioned, I think about people saying that SNAP recipients are, like he had mentioned, lazy or don't want to work. That's a huge misconception. I looked at some of my figures, and of my SNAP recipients, roughly 60% are adults. So that gives us the other 40 who are children and obviously not working. Of that 60%, 26% are aged or disabled. So that's 26% right there. And of leftover of the 60%, 20% are working. So that roughly brings us with 14%. So those are individuals who are not working. What are those people? Those people, if you don't meet any exemptions, and some food assistance exemptions might be obviously the aged or disabled or children. They added a couple new exemptions this year. Former foster children are exempt from work participation. They obviously have some other challenges and barriers that they're dealing with. I think Deb mentioned earlier Maslow's hierarchy. That comes into play. They have some other things that they're focusing on. Veterans as well is a food assistance exemption for participation in work. And this is a new one, homeless. They've got all types of other issues that they're dealing with just to stay warm. So that leaves us with the individuals who we call ABODs, able-bodied adults without dependents. So that's those single individuals who are not working. Those individuals have an assessment, and I tell everybody is different. Everybody comes with their own set of experiences, and through this assessment, they will find out, do you have your GED or diploma? Oh, you don't? Great, that's your assignment for food assistance. Let's help you get your GED. Let's help lift you up. Maybe you've got some mental health issues that you're dealing with. Okay, your assignment is to attend these doctor's appointments. So they're all things that we do to help lift you up. I remember years ago when I did casework, I had individuals say, well, I'm not picking up trash on the side of the road. I said, not unless you aspire to do that. Everybody has different work employment interests. So yeah, if that's something you want to do, I'll definitely help you meet that goal.
Do echo everything they've said. With our demographic in particular, the misconception that I've heard is that, oh, well, they didn't manage their money well while they were working, so now they're in this position, which, you know, I just caution everyone not to rush to judgment. You haven't walked a mile in someone's shoes, so please don't think, oh, I know why it is that way. It is, as they have mentioned, it's difficult to ask for help. So, we want to make sure that we're providing people dignity, and a safe space to come and talk to us if they do need help. And just don't rush to judgment. Don't think you know why someone is afflicted by something that they're afflicted by.
But listening to some of the responses, something that came to my mind is that if everyone, closed their eyes and I said baseball player, you would have a visual image of a baseball player. If I said football player, but if I said someone who's food insecure, what comes to mind? That there's no stereotype that really fits reality. And I think that's hard for people to wrap their arms around. I don't know if we as humans need some type of image to attach to that or not, but in reality, it's, everyone is, like you said, 1 or 2 paychecks in reality away from being food insecure. And one thing that we struggle with a lot of our families, and I think it is a pride thing, and I'm not sure why we hear it a lot, but we often hear that someone else needs it more than I do. And I get that, but we're here for you too. And so sometimes just putting it back in front of them, letting them know, hey, we're still here. If your opinions change or your situation has changed, we're here for you. So I think that's helpful for us to repeat that.
One final question, and as we're answering the last question, I would encourage you, please write down the questions that you have. The staff will be coming around to collect your questions. Also, I want to remind you, if you have a business card, if you did not submit it, we have a drawing at the end. Go ahead and we'll collect those, put those in for a drawing. Write down your questions again on the green slips of paper that are on your table and raise them up and come around and collect those. So with our last question, what should we do as individuals if we suspect that someone we know is dealing with hunger or food insecurity?
I think the first thing we have to do is just listen. I think we've all set up here on the panel is that food insecurity is just one aspect of everybody's life, and they may or may not need us to fix anything. They may just need to share their current circumstance, kind of talk to an adult. I know for a lot of our families, a lot of our moms come in and we are a sounding board. They just need someone to talk through what they're experiencing. And if it comes time and it seems appropriate, we just need to offer what we know and what's out there. Provide the resources, provide contact information, let them know what's available. And when the time is right, if they're ready to reach out, they can do that. But that's on them. They have to make that decision, because I know at least for our program and probably for a lot of your others, they need to be committed enough to make an appointment and follow through. And so they have opportunities to step forward, and if they get cold feet, they can call back and reschedule it. But I think we can't push them. We just need to put everything in front of them and let them make their decisions when they're ready.
Yeah, I second that. I was just gonna say, talk with them, have a conversation. Some people don't know the resources that are available to them. Some people may not be willing, like you said, to ask for help. But human services is a relationship-based industry. So just have that conversation, let them know that you're there to listen to them, to provide help if they need it, or to point them in the direction. Our goal at LCAP is to help people remain as independent as possible and to remain in their homes. And if there's any service that we can provide to help people do that, that's what we're here for. And if it's not something that we can do, maybe we can put you in touch with someone who can. So, but it starts with a conversation, and just letting them know that they're not alone, because sometimes they may feel that they're alone.
I was gonna say, as far as access to the SNAP benefits, the way Job and Family Services administers and allows customers to have access has drastically changed over the years. I've been with the agency almost 25 years. And over that course, individuals who wanted to apply had to actually walk into my agency and fill out a 8-page application and have a face-to-face interview. And over the course of the years, the state has waived, we saw individuals every 6 months as well. So our foot traffic was horrendous. We used to fight over interview rooms. Or have individuals sit at your own cubicle. So the state has made some changes as far as access to benefits and transportation to come to the agency. Every 6 months now, they are issued this interim report that basically says, you have any changes, report them, verify them. So access to the benefits via a piece of paper mail-in, phone interviews. The state now allows us to do phone interviews for food assistance. Also, technology, applying online. So the agency created a resource group, and that was great back in 2008 and 2009 when we created it. And then the state allowed the phone interviews. And so that's our biggest application avenue right now is over the phone. So we've created this, I call it good, better, best. And it's the way that applicants, the people can apply for food assistance. You can do the paper way, that's good. You can do it online, that's better, or best call. Our phones you can call Monday through Friday, 8 to 3 for food assistance and 4 o'clock for the Medicaid assistance. That's where most of my applications come from right now. You can still, well, it gives the online avenue to apply, but we still experience those individuals that aren't very computer savvy, and just the phone way has really been the way to go. I do know these past few months we've experienced a little bit higher phone traffic, and that is another another avenue for people to apply. Also ways to turn in benefits, or ways to turn in verifications for benefits. We're usually going to ask for income and expenses, and depending on your program, sometimes it's resources. So how do I get those verifications to Job and Family Services? If you're computer savvy, you can upload it to your own personal account. What I see a lot of now, and I think it's great, a lot of people have the smartphones, take a picture and email it. So that's a great way to get benefits. I have some customers that I consistently just mail our return envelopes. Or if you want to come in and come see, you can always, we're still here for you, so.
This community has been so helpful in fighting food insecurity. And so I think that for us, especially as we go through some of these changes, the best thing to do is to refer individuals to us. Hunger doesn't look the same for everybody. Everybody has a different need. And so based on what their situation is, then we're going to be able to best determine how to help them. Another thing I would encourage, please come in if you're part of the community and visit our warehouse and learn about our programs, learn about our partnerships. We are going to, hopefully with that new market style, have the ability to offer more wraparound services. One of the locations will be with Licking Memorial Hospital, so then they'll be able to have their resources there to help individuals as well too. Going back to that dignity and that independence that people strive for. And I think when you when you have conversations with individuals that may be facing food insecurity, just remembering that this is a difficult conversation for them. And so, our goal is to make it more warm and inviting and let them know that they're welcome here. They're not taking from others. They'll see the food that's there and, they'll take what they need, and it's here for them. But connecting them with us, and then if you would like to come see what we're doing and the changes we're making, I highly encourage it, because it is something that is on our forefront. It's hard for us to remember to get out and tell everyone what changes we're making and what we're doing. And word of mouth is the best marketing tool out there. So.
I don't believe it's ever wrong to come alongside someone and say, what can I do? What do you need? How can I help? Our neighbor reminded us the other day, my wife and I, if you see something, say something.
All right, great answers, everybody. As you can see, we have some very passionate, very caring, and knowledgeable people in Licking County who care about the work they're doing to address food insecurity. So we're very thankful for each and every one of you. We've got some questions from our audience this morning, so I'm just going to take a few of these and we'll try to get through as many as we can. So bear with me as I read them. In terms of directing people to resources, does 211 provide any pre-screening to help with that? And anybody can answer these questions up here.
I've never dealt with 211 here in this community. I guess the one question I would ask and follow up to that, do we have like a street card? Or something that could be, lists all of the agencies in town and what they need based upon food, utilities? Do we have something like that here in this community?
Yes, in previous years, over the last years, we have created some of those cards that a variety of our organizations have had access to.
Could you get me some of those? Thanks.
For us, 211 is a resource that I think it's difficult, again, to keep them updated with what we're doing. I do hope that our new market style, grocery store style experience for our customers and changing up the regions will make that a little bit easier for those that are referring people to our agency. But our phone number, for those of you that may want to refer someone, is 740-344-7401. 740-344-7401. And again, that will be the number that you want to refer someone to, because we know our programming best.
Yeah, I have seen I think I have on my desk as well, a card with, other community agencies. It's like a little trifold card. Also in my application packets, we have a community resource list. As far as 211 goes, 211 is wonderful to know about all the different agencies. So if you say, I need help with food assistance, they're probably going to give information for all these different organizations. And I think it was Todd that said earlier, they become the WIC experts. There's no way that 211 can know that my food assistance eligibility is 130%. Unless you're able, blind, or disabled, you get 200. They can't know that. There's no way. It's a resource, but I think it comes back to the individual agency where those phone calls need to be fielded. Because a lot of times in the community, there's always that misconception, well, my neighbor, my sister, my somebody, not everybody's situation is the same. And there's those little nuances in there that I would never want anybody to get wrong information and not apply. And I always tell my staff, everybody has the right to apply.
Unfortunately.
Okay, well, 211, in case everybody doesn't know, right there, Ben has a card. Right here, you asked about a referral card. You have these cards. 211 is the resource. Actually, it's available nationally. Ohio and our governor is really pushing 211 across our network. It is a 24-hour, 365 days a week referral hotline. It's only as good as we provide the information to that, then we can get the information out of that. But it's a great place to start if people are looking so they're not driving around or having to carry a card. It's one number to remember, 211. So I encourage everybody, get familiar with the resources that they have available. Ben, if you want to share that card with 10 down there, showing what's being out there. A second part of the question that came with that question was, and you've mentioned this, there are different income eligibility guidelines. Is there any likelihood or possibility at some point that the income eligibility guidelines will all come in alignment at some point? And that was a question.
No.
Why not?
Well, I think we're all under different agencies, whether it's and I think most of them are not even state, it's more of a federal thing. And so maybe someday uniforms fly, but sorry. I've been in this kind of environment too long, but it is very complicated. We do try to, I don't say overlap, but with WIC, we do have something called adjunctive eligibility, which means if you are eligible for Medicaid or food stamps, you are automatically eligible for WIC regardless of income. And the idea behind that is they have already assessed that we don't need to. Now when you get to other programs, I don't know, I mean, my short answer to that is probably no.
Kind of as I mentioned earlier, 60 or older and living within Licking County is our only requirement. We do an assessment and an intake where we may gather some of that information just to have data to show, but those are the only requirements that we have.
Yeah, I don't see that happening as well. I'm looking at, this is one of the charts that I made for my staff, and this is just for cash assistance, food assistance and childcare, family size and eligibility. Each one has different standards. I just can't see that changing. But one thing we can do is, and I think the state's working on, is just coordination of benefits. And I think that's between like food assistance recipients and with WIC. I'm getting some word that we might be partnering with something to help that be more of a smooth transition versus two different agencies with two different things. So I guess that's a bonus coming.
Yeah, I'm gonna say no.
I don't think we're gonna ever see it, but I think for us, a lot of our funding is grant funding. So we have to live within what the grant funder says, so whatever their guidelines are, that's kind of where we have to be.
I'm going to piggyback just on that and jump in here a little bit. We talked about the varying levels within the federal poverty guidelines, what percentages each of your organizations fall under. We've also known that we are continuing to address ALICE. So if the ALICE population, that population that is above that federal poverty guideline, that's struggling with food, transportation, housing, medical care, child care, those sorts of things, technology, and they don't qualify for some of your programs up here that we've just talked about, where do you see else folks can go to get food assistance if they don't qualify, but they're struggling? Because what we know about the federal poverty guidelines, that we've not had much movement since the 1960s, right? Our costs have not kept or have exceeded, I should say, our wage of living. So do you know of any other services or programs or ways that our community can specifically target the population that's food insecure that don't qualify for the programs that we have up here?
We're gonna work our tail off to get them into our building. We're gonna do whatever we can to provide for them. Every workaround that we can get. Our food pantry, really, anyone who comes in our door needing food is gonna get food.
Okay.
I'm not gonna say, oh, you make too much, I can't help you, go see. No, that's not how it works in my office, that's how it works for me. If you need it and I can physically provide it, I'm gonna provide it.
So we at the network serve individuals who are 200% above the poverty line. So that's our cutoff. So we do serve individuals. I think Christa was at 130 and Todd at 185. So we do serve higher than them. It is self-declaration. And so if they come into us and they say that they need food, then we do, they fill out our form that the USDA requires and they give us food. I have a higher education background, and that is I'm the pushover. If there's ever someone that doesn't have the ID, if you ask me, it's a yes, right? Like if they've come, they've stood in line, they've asked for food, and we have it, so we give it to them. But yeah, we do like to think that we are that service that can help where the government maybe isn't able to. And it is self-declaration.
Yeah, as Alyssa mentioned, their guidelines are a little bit higher than my 130. So usually if somebody comes to see me and they are not food assistance eligible, I'm going to direct them to one of my partner agencies. And a lot of times I just put myself in customer situations. What I do, you know, I'm married and have 2 children, where would I go if I don't meet this eligibility guideline? I'm gonna reach out. And a lot of times, a lot of local churches just have their own little food pantry. So, you know, and I am not in the, giving references guidelines. So I flip open the, I don't know, do people have phone books anymore? But back then, when I did casework, open the phone book to the yellow pages. Just find a local food that's close, or a local church that's close to you. Maybe they have their own little pantry that's not in some wide known, you know, 211 or something like that.
Yeah, kind of second what Tim said, if it's not something that we can directly provide, we're gonna, work very hard to maybe put them in touch with someone who can provide that service or the assistance that they need. But we do everything in our power to make sure a need is met.
This is a perfect panel because the folks to my right is who we refer our families to when our hands are tied.
Okay, thank you. Next question, can you speak to the idea of not only getting people food, but getting them food that they can cook, their families will eat, or recognize perhaps cultural differences? And I think someone mentioned this. How are we starting to work on that?
As far as our program goes, they have the choice to buy what they want when they get to the store. I know the example that always comes to my mind when you talk about food pantries is providing somebody with a can that needs a can opener and they don't have one, or something that's cold and needs to be refrigerated and they don't have a refrigerator. I mean, we have powdered milk available on WIC. I've been here for 23 years and I've yet to meet a family who said, I'll take powdered milk. But when they go to the store, they have options. Now WIC is slow to evolve, but we have evolved to the point where we used to provide bread. That was our whole grain option, was bread. You now have the option to buy pastas, tortillas, brown rice, oatmeal. So you have some other options, and it's in the works to add additional options. We used to have peanut butter. Well, we have peanut butter, canned beans, and dried beans, and depending on who you're talking to and where you are in our county, you will see different options chosen more often. And so, again, some of our options do have flexibilities and some, there's more coming. The wheels turn slowly sometimes.
Again, with us, we're providing for an individual, but we do offer what we call a regular meal, a low sodium meal, or a cold meal option. And then part of the intake process and talking with the people we serve is, are there any food allergies? Are there any special dietary needs that we need to meet? So we run a report every day that, you know, someone has a allergy to fish or nuts. So we've got to make sure that if that's in the meal, we take that out for them. Have little stickers with their names on it and the allergies, and then the drivers make sure on the tablets, like, you know, please don't deliver cheese to someone who has a cheese allergy. So we just want to be very mindful of that. And I think our kitchen staff, Tully, does a great job of being creative with the menu and providing a lot of different nutritious choices. And we also do have some people who have religious preferences that they may not be able to eat pork, so we take that into account as well and make sure that we're serving them meals that fall within those guidelines.
There's not too many guardrails around using the SNAP card. What I'm thinking of off the top of my head is obviously the restaurants, the fast food, and deli food. Something that you can stand right there and eat is usually how I explain what you cannot use with the food card. Other than that, you know, just basic any food that fits their family. And I think part of the question was educating customers on healthy food choices or something. What popped in my mind is we have partnered with the OSU Extension Office in the past, where they would do some food education courses on buying and making healthy meals for the family. So that is out there.
I was gonna ask you to repeat the question because it was a long question.
Yeah, basically, people are wondering, as we think about increasing and our communities changing, what sort of resources are we offering those culturally different requests?
Offer the different choices for the different needs. Okay. Well, and that again plays into the market, and that's really that market style. It's a grocery store experience. So our customers will now walk in, grab a card, and go pick along the shelf what it is that they want. And so looking at other models where this is happening, you know, we were there and someone just grabbed a gallon of milk. Now, the way that we're currently set up, that would count as a visit for the month. And so chances are, that mindset that we were using sort of encourages that hoarding of food, because even if I don't need it at this moment, I'm going to take what you're going to give me because you're going to mark it against me for the month. I also use the example, I don't have a cultural example personally, but we give out whole chickens, and I don't know how to cook a whole chicken. And it's already hard enough to ask for services and ask for help, as we talked about before. And so I'm not sure if I was walking around with someone, I would want to admit that I don't know how to cook up the chicken, or that my stove broke and I can't afford to fix it. And so I have nothing to do with that. And so the ability for them to shop on their own for us is a new model, and hopefully goes into the mindset of they are really the customer that is deciding what is right for them, the right time, the right place, the right location, the right kinds of food, so that they can choose what it is that they need, and they're not being dictated to when they can go or what it is.
We too have used the OSU extension when it comes to cooking, to come to a food pantry, to get a box of food, and then we have people from OSU extension say, okay, here's some recipes that you can make with this direct food. Which was really eye-opening, because I wouldn't have thought of some of the things. They were really kind of nice recipes. And I love to cook. I'd eat more. The other part is being culturally sensitive at times. That's a hard one. Those types of foods are not always available for us to get. So if I get my inventory from Chuck every month, and I need something, for, I don't know, an Asian family. If we have an Asian family come, that might be hard. That might be a hard lift for us. So then we have to look in other areas to get those types of food. So being more culturally sensitive can be, I think, is a barrier for a lot of us. With the SNAP card, that's great. They go to the store and they, get, but my clients may not have that when they come to our food pantry. So being culturally sensitive is something we try, but we're not always 100% successful.
Great. Well, I want to thank all of you again for everything that you're doing for our county, again, for your passion, your care, your expertise, and helping us to address food insecurity. And I would invite all of you to join me as we thank you. We can talk about this all day, but we don't have time. But again, thank you for making our community a better place and helping so many people. Appreciate it. Few announcements. Want to remind you that we do meet every month for the Community Partner Council Forum. Again, we have a whole slate of forums already scheduled for 2024. Ashley Washburn is a member of the board of directors and our CPC rep. Ashley, and would you like to say a word about next month?
Yes, we're just excited to do a service project, so there'll be more information coming out as we we're trying to find those kind of school age youth falling through the cracks, who might not be affiliated with certain programs. So we're still in the works with getting you guys a service project around that. So look in your emails, if you regularly come to CPC, for what that's going to look like. We just kind of want to get together and kind of celebrate our blessings and give back. So we're excited to do that with everyone, and excited to see you all for the upcoming forums next year. But like Deb said earlier, if you ever have any ideas, please reach out to us. We love to hear the input of the community as we're planning this. Thankful for the committee. I see Sylvia, Haley, and Jamie's on that. Corey sits in that, and I'm just very thankful to have the support of everyone who's interested in helping. So please reach out with ideas or what you would like to see, or if you would like to start a plan, that'd be great. So thank you.
Thank you so much, Ashley. Again, United Way is concerned about improving lives throughout Lee County. And we bring people together to learn about the issues and to advocate for these issues. I'd be remiss to say also, though, we need your help, we need your support. Every year, we ask the community to donate what you can so that we can continue to work together and address issues that are the most important critical issues facing the health and well-being for our community. So please donate to United Way. You can do that online directly, or you can also do that through your workplace giving opportunity. Also want to encourage you then to volunteer. I think a few of our panelists said, get involved. I'm sure any of these folks up here would be glad to tell you a variety of ways that you can volunteer your time and your energy to help improve one of these programs. But there are a whole host of programs that aren't here. And if you'd like to get more involved, please contact United Way. We have just launched a volunteer hub for Licking County. And one of the things we're going to be doing in February is hosting a volunteer, not-for-profit venue, a fair, connecting individuals with not-for-profits so that we can build capacity across Licking County, get connected and volunteer, and then advocate. I think all of you, I think the question we said, is there any chance of aligning our eligibility? And all of you said no. Dollars come through a specific way. Talk to your elected officials, get involved in raising your voices, speak up for vulnerable people in your community, and so that we can get the kind of help our elected officials want to hear from all of you, and they want to know about causes that matter to our community. So perhaps increasing line items that address food insecurity and raise the eligibility limits, that might be a place to start. So advocate for programs that address food insecurity. So with that being said, want to thank our staff over here, Llewellyn Dees, who is our volunteer outreach director. She will get you connected to volunteer your time. We also want to thank Andrea Rawl over here, who's our development director, and she is out raising dollars to give back to the community. So thank you, Andrea. Ashley Washburn is our marketing director. Anna, sorry. Ashley. So if you want to watch this or pass the CPC forum on to somebody else, it'll be on our website so that we can help educate other people. And then Corey Stutz, our program and operations director. Thank you, Corey, for helping us. Do I have any other board members here? I think that's it. So again, thank you to our sponsors, Living Memorial Health System, Nationwide, John Hendra Honda, and Denison University. We're going to draw out a business card somewhere over here. I want to do it. Go ahead. Who won?
Amy Dell.
Amy. Yay.